Now, Sheena has asked a really good question here as well about when to be directive or non-directive. Often as therapy people, we think about being as non-directive as possible. We want that person to take the lead, to show us what direction to head, things like this. That's very hard when you're facilitating an outdoor experience where you have to take the lead. I have to know that my client is safe. I have to know these things. And we'll get to more of this when we think about the trauma questions and triggers, but one of the things I'm thinking is I want to be able to feel comfortable leading activities that I know I'm in sort of my own comfort zone as the facilitator. If I'm leading something where I know I'm going to have to control and be more directive, a good example is like mountain biking, right? Great activity. It's a very dangerous activity because we cannot control our client. Similar with jumping off something high into the water. Super fun, could be very therapeutic, but everything your client does is based on them and their ability to do it safely. So it's hard as an adventure guide to keep those activities safe. Where rock climbing has a lot of perceived risk, if you tie knots correctly, if you have safe gear, not that dangerous of an experience. So if I'm doing mountain biking, I'm probably going to have to hold the experience really tight. And that might mean on the therapeutic end, I'm not letting them experience that, I'm not letting them freely experience what we're doing as freely as they could. And so that's one of the interesting conundrums is we have to reflect on ourselves. What are we comfortable facilitating so that we can be as non-directive as possible to give our client the chance to experience as they are? What happens in aged care is a really good example. Aged care, we take people, and this is all under a lot of inquiry in Australia right now, because we are so scared of risk. We actually ruin people's quality of life by controlling everything at the end of their life, to the point where we control everything. They just sit in a bed and do nothing until they pass on. So a consideration is, how do we actually give them freedom and think about, there's a great saying called the dignity of risk. If we're being directive because we're scared of risk, we have to consider whose risk are we protecting. Most often, it's so we don't get in trouble. It has very little to do with the client's experience. So if we're going to go rock climbing and the whole time be so scared of risk so that we don't get in trouble, we're better off not going rock climbing for a therapeutic purpose. So it's things like that that we should think about. How much freedom does our client have to experience nature? Because if we're controlling their experience in nature by being very directive, they're going to associate nature with us telling them what to do. And so then they don't have the space to freely make meaning, to freely benefit from all the healing possibilities from a nature experience.